All right, welcome back to the Hip Pain Relief course. In this video, I want to cover how do I know if I can help you, right? That's the key. Everybody wants to know that, right? I meet people that come into the clinic in my physical therapy practice over the past 11 years, 12 years, and they want to know right away, like, can you help me or not? That is the question, right? And so I'm going to give you the test that I give them. You see, it doesn't help me or you or them if I have you spend all this time and energy and money getting treatment from me or listening to this video and come to find out I can't help you, right? That doesn't make me look good. It doesn't make you look good. It doesn't make you happy. And so ultimately it's a negative cycle to be in. So let's try to address that right now. So what I want you to do is I want you to think to yourself, what is the activity that you've had that you were doing? The INGs, as I mentioned earlier, that has caused you the most pain in the last 2 weeks or maybe even 4 weeks. What's the thing you were doing, right? So you think about that right now. So for me, it was after a round of 18 holes of golf. Okay, so I know what that was. And then I also know that for me, it was a 4 out of 10. And it was in my right hip. And so I want you to think about what is that? What was the degree or the intensity of pain that you had during or after that activity, right, that you've already identified to yourself. So now you just say that out loud, right? So I already said it out loud and you did too. So now that's, first of all, it's really good if you identified first that there is an activity where the pain was increased, or in my case, became present. I didn't have it before, but it happened after this activity. If you could identify an activity where you know it was the worst, then the assumption is there's other activities or resting where it doesn't hurt as bad, right? So that's actually a good sign from my perspective. That means that I can help you because we know that it's a movement-based problem. It's because of movement. Now, on the other end of that coin, the flip side of that coin, if you're the person who has constant pain no matter what you're doing and it doesn't change in intensity. So for example, it's a 5 out of 10 no matter whether I'm sitting, laying down, walking, running, lunging, hopping, jumping, reaching, pushing, pulling. It doesn't matter. It's always the same no matter what I do. It never changes. Now you can have pain all the time, but the key is it never changes. That's a bad sign. That typically means there's something structural going on. Think a broken bone or a fracture or a osteophyte or bone spur or something is torn, right? Those are surgical situations typically. But most people that I meet, there's a change in intensity or a change in frequency of the pain with certain movements or activities or positions. And if that's the case, then I can help you. This is going to be helpful because I'm going to show you how to identify where your movement restrictions are and then improve those restrictions. And most of the time it's not in the hip itself, it's in the areas around it. So hopefully this helps you have some confidence in what we're talking about, and I will see you next time.